This is Gina Stutchman. She's with the Arbors Memory Care in Sparks, and we're talking about a subject that some people may not think of, but with the holidays, and it's possible that people obviously don't live with their parents, maybe they live in a different city, so they don't see them quite often as some of us do if we're in the same city with our parents. And you bring up an important point about what are some signs to look for when you are visiting your parents. And of course, with Alzheimer's and dementia, all those terrible things that can happen with aging. It's scary, and it's so heartbreaking to see a parent go through that.
Amanda, it really is, and I think a lot of us deal with denial when we're dealing with this. So what I suggest is just some small steps. When you first get there, give them a big hug. Take a look at, have they lost a lot of weight? Have they gained a lot of weight? How's their personal hygiene? Just mostly an overall well-being.
Let's throw the full page up that we have of all the tips. So we know, of course, hygiene, a big one, making sure that they've been showering regularly. How is their weight? One thing you said is look in that refrigerator. Exactly.
If you see a lot of outdated foods or a lot of the same thing, people get in a routine and they'll buy 2 cans of Ortega chilies every time they go, and you go to your mom's house and there's 45 cans. It's kind of an indicator.
Yeah. They can be a little bit, I guess you could call them hoarders sometimes with dementia, unfortunately. One thing I've learned, because I'm dealing with it a little personally, and I will tell you, clutter can make them worse, for sure. How is their house being maintained? You say that's another big one.
Definitely, definitely. The organizational skills, the ability to make decisions, executive functioning. You might want to also take a drive with them and let them drive, see if they're still safe and comfortable finding their way around to the normal places they go, the grocery store, the doctor's office.
Yes.
If you're got white knuckles by the end of the ride, then maybe there's something that needs to be addressed.
For sure. We experienced that last year with my fiance's father, who's in his early 80s and loves to drive. And I think, that's the thing is, you don't want to be taking away their independence. No. And I think that that's why sometimes we are in denial when we see these signs that are very clear. Also, you say it's important maybe that they know their neighbors. You have to have that conversation, if you can, with their neighbors.
And just make sure the neighbors have your contact information. So you don't want to dump the responsibility on them, but you want them to have a point of contact. So if they see something, if they see your mom out in cold weather with inappropriate clothing, they've got a phone number to call and give you a heads up so you can start monitoring and make sure everybody's in a safe environment.
I know that plenty of people out there, they caretake for a parent, or perhaps your parent lives with you, but when that parent is in a different city, it's so hard on you because you just are filled with worry, and rightfully so. Now, if you see some of these signs, do you go to the neurologist first, their primary care physician? I mean, who do you contact first with that concern?
Primary care physician is always good, and with HIPAA, it's a challenge these days.
Sure.
They won't give you feedback, but at least you can give them information and hopefully talk your parent into allowing their physician to communicate with you. That's a really big one.
Now we're about out of time, Gina.
All right.
It's a topic I'm interested in, but now we're about out of time, so I'll post this interview online, even with more tips, but I appreciate you coming in. Gina Stutchman from the Arbors, coming up in our